Dr. Weber, I want to thank you first off before we get started. Thank you for gracing us with your time and your knowledge. It's a very important topic, and I just really want to get into it. So first things first, Doc, tell me what excites you about TMS.
Pretty much everything, and thanks for having me. You know, like I said, I really do appreciate all your videos, and I really like how you really approach TMS, and so I appreciate this opportunity. Thank you so much. So yeah, TMS, pretty much everything. I'm trained adult. I've seen kids. I'm addiction trained as well. I spent 27 years in uniform, so I got trained by the military. Thanks for paying your taxes. Appreciate that.
Thank you for your service.
Yes, sir. Yes, sir. So, I have a particular aspect that I've had this training, but I've always had this block in the sense of trying to get TMS in the military, trying to get ECT, trying to get the military to do anything that was outside the box was a little bit difficult and challenging at times. However, I retired in 2016, and I got the chance to start this practice with my wife. My wife is a family practice doc. We've been together for 25 years. We went to med school together. So I did flight surgery and psych. So I was a flight surgeon before psychiatry. And then I went to psychiatry, and then she was a family practice doc. And so we started this with her focus was more on addiction with the Suboxone before morphine.
Okay.
Yep. So she was helping augment that with myself. And then I was doing a holistic aspect of outpatient. So I really wanted TMS, but I wanted the medications. I wanted the talk therapy. I thought biologically, psychologically, socially, spiritually, this is how we get people better, right?
Yeah.
And I could not find a better biological leg to that other than TMS. I mean, when you look at the literature and with the side effect profile being so minimal, with the amount of efficacy there, I thought it was untapped. And most of my medications, are poison or poison light, right? I mean, they do work. They do have their place. I still prescribe. I still see patients.
Okay.
However, I'm not a fan of big pharma, so I'll go ahead and throw that out there right away.
Amen. Amen.
In that sense, I think that we've really had a travesty that we forget about those other aspects, the psychological, social, and spiritual aspect. I mean, it can't be all just meds. And I actually don't believe it can't be all just TMS. That TMS will reduce those symptoms in such a dramatic way, other than the medications, that then we can take advantage of those other ones. And we actually move on those. We have outcomes measurements. We have value-based kind of approach here at Family Care Center. And that's what we're really focusing on is how do we get the patient better to get them into those other aspects of their life? I want them out of the chair. I want them off the meds. I want them through therapy, and I want them to have a better life. TMS does that.
That's amazing, doctor. That is amazing. So when we look up what's going on the internet and what people are searching for in regards to TMS, one of the most common questions we're getting is TMS safe?
Safer than any of my meds, right? So, the side effect profile of a slight headache, some palpitations in the head that, from the tapping, those go away. And actually, I have a protocol, and I think most people that have practiced for a while, we do a ramping kind of protocol, so we don't even usually have those.
Yes.
The seizure risk is so rare. I think the last study I looked was 1 in 30,000. There's a popular game system that has a higher seizure risk if you play it than TMS. I mean, it is.
Wow. I haven't heard that one.
Yeah. Oh, yeah. So if you look at a lot of things that can induce seizures, have you ever seen one of those movies that like this has a lot of strobe lights or photophobic, this could induce a seizure? Those things actually can. TMS has not. So
wow.
I mean, TMS can. It's a very, very rare side effect. I think we
have to give that disclaimer, right?
Oh, yeah. There is a rare chance. And I do have a Brainsway. So probably Brainsway has the highest percentage chance. So I've tried 3 different machines. I also have an EEG directed. I do a very personalized approach to the way that we do TMS here. And actually, we just published because I use a bilateral approach as well as different level hertzes. And so I don't believe that just 1 hertz or 1 frequency is what you need. And so we really make it very, very personalized. And after doing thousands of these, and I've overseen over 35,000, and I think my practice maybe 120,000 treatments,
Wow.
so
Wow.
in aggregate. And so, it's been, when you can see a lot of these things, the bell-shaped curve starts to look, a little bit different. And then you can start piecing things together on how we can actually personalize this for each patient. It's very, very safe.
That's
In fact,
amazing.
I'll just give this, my wife said I could say it. I practiced on my wife. So when I was first learning, I was mapping and remapping her and treating her, and she's
I
doing
love
great.
it. I
She's doing
love it. When I'll add, when I went through TMS, my biggest thing was I'm gonna get so much better, and my wife's gonna be left in the dust, man. I gotta get her in a chair too, right?
Exactly.
So she's gotten treatment. My kids have gotten TMS. We're a TMS family, so no, I totally appreciate you sharing that one. Hey guys, if you found that video informational, want to see more, do me a favor, click this video right here while I enjoy my TMS sessions. Did you click it? Click it already. TMS, it's life changing. This video right here is going to help you.